So let's talk about kind of the debriefing and the checklist that I prepared along with my dental assistant when I was in practice. So we did a lot of surgery. It was an implant prosthodontic practice, so there were a lot of extractions, a lot of, doing implant placements, a lot of soft tissue kind of work to uncover implants in preparations for abutments and so forth. So where did the frustration come in for me? Well, the frustration came in for me that, for example, if we were going to be uncovering an implant, very often I would use a tissue trephine. But if there wasn't enough attached tissue, I would have to use a scalpel. And depending on the length of the teeth and the interproximal space where the implant was covered underneath the tissue, sometimes I would have to use a longer scalpel than like a 15S. I would use like an 11 scalpel blade. Something as simple as that, having either an 11 or a 15 or a 15C scalpel blade on the tray, was exactly what should be done every single time. Now, you don't open up all the scalpel blades. You have the packages there. So one of the things you want to do in the debriefing is talk about a procedure as simple as uncovering a dental implant. And do you have the instrumentation, the armamentarium necessary to do that? So do you have all different types of scalpels? Do you have different kinds of tissue trephines? Do you have different healing abutments in size and width? You want to have all of that stuff on the tray because that procedure is truly a 5-minute procedure if you have what you want there. But if you don't have what you want there, you have to wait for a scalpel or a certain type of scalpel, or if you have to wait for a tissue trephine, or you have to wait for a certain type of healing abutment, not only in height, but in width, that just delays everything. So have all of that stuff laid out there, and on your checklist, which you're going to develop after a debriefing, you're going to know exactly what the doctor wants, and the doctor's going to be able to tell you exactly what he wants or she wants as well, and that's how the checklist gets developed. So each procedure, no matter how simple, needs to have a checklist. Here's another idea for a checklist on a very, very simple procedure. You want to do a post-op after an extraction. You have placed some sutures to try and get as close to primary closure as you can with that. And you need to be able to have suture scissors and some type of tissue forceps to remove the suture. And it seems like a pretty straightforward thing, but you also need topical anesthetic that you may want to put on top of the tissue so you don't hurt the tissue cutting the suture and removing out of the patient's mouth. If that's your procedure, then you need to have all of those things listed out. There's nothing worse than having the patient in the chair for a really simple procedure and you don't have the armamentarium, the equipment, the supplies that you need to do something as simple as a suture removal. At the end of the day, in the debriefing, talk about every single little tiny procedure and what went right and what went wrong. And by removing the wrong things, it makes those procedures really fast and easy. It shows professionalism to your patient, which is really important, and it's going to actually just lower your stress level.